and tricks. No matter what type of mask you are wearing, you want to make sure it's secure on your skin. You want clean, dry skin. Moisturizer and serums are good. In my opinion, having worn a surgical mask for the last 20 years as a surgeon, I don't like to wear a lot of foundation or makeup on my face when I'm gonna wear a mask, because it all rubs off on the inside surface of the mask. And if you're gonna reuse these masks, that makeup can fill with a lot of bacteria and stuff, and you don't want that on the white surface or inside surface of your mask. After you take your mask off, you want to wash your face really well. You might have dents on your upper cheeks from the compression of the mask. If you wear a looped mask or one of these N95s with the elastic, you might have some pressure on the back of your ears or the top of your head. It's okay to massage those areas. It's also okay to use little tricks like securing this onto a wide headband to take pressure off your ear if you have to wear it for a prolonged period of time. But stay clean, stay healthy, stay positive, and stay home.